Good morning, beloved judges, committees, all participants, and friends. First, let's thank the Lord who has given us this wonderful day so that I can present in front of you. Second, let's thank Stikes Logorjo Semarang and all committee who have organized this competition. And third, let me introduce myself. My name is Abigail Sharon Kusuma. You can call me Abigail. And I'm now in my first semester of professional nursing education in Stikes Logorjo Semarang. And yes, for my study, you can know that I am a nurse to be, and I've been practicing in a lot of hospitals, seeing many patients with various diseases, curable and even uncurable. Hospital in Indonesia has always been the very first thought of where people must go when they got sick, but that was at the past. Ever since 2020, when COVID enters Indonesia, people who got sick would never thought of going to hospital because they don't want to get infected even more. So that era was the beginning when telemedicine in Indonesia became very famous. Indonesia Health Ministry, or what we always call as Kemenkes, has listed at least 11 platforms of telemedicine that can be accessed freely by Indonesian citizens. They are Halodoc, YesDoc, AloDokter, ClickDokter, SehatQ, Good Doctor, Klinigo, LinkSehat, Milfik, ProSehat, and GetWell. Araminta and Sofianingrum 2023 stated that users of telemedicine platforms has increased from 2 million users in 2019 to 20 million users in 2020, so that we can imagine how much more users are using it right now up to 2024. We've been talking about these telemedicine things, and if you're wondering what it is, let me explain to you about it. Peraturan Menteri Kesehatan Nomor 20 Tahun 2019 tentang penyelenggaraan pelayanan telemedicine antar fasilitas pelayanan kesehatan state that telemedicine is a clinical facility service through telecommunication and digital communication technology that allow us to exchange information about disease diagnosis, medication, disease and injury prevention, research and evaluation, and education of healthcare providers in order to improve the individual and community health. Basically, in simple, telemedicine is a facility service through the internet that allow us to get as many information as we need about health. For example, people who are sick at home, they can simply open their phone that have internet connection and go to one of the platform of telemedicine that I've mentioned before, and they can type whatever things they want. They can consult doctors, they can get a diagnosis of their disease, they can get instruction of what to do, and finally they can order medicine just from home, and that medicine will be delivered home. Besides that, telemedicine platforms also provide information about health and other special service that we may need. For example, midwife service, diabetes care, heart care, skin care, mental care, pet care, and parenting. They provide many articles that we can read, and these articles is based on the research. And those articles suggest us many things that we can do to improve our health. And not just that, most of the telemedicine platforms also have features that can be used to early diagnose whether we have some certain of health issues to prevent disease and to prevent injury. For example, they have stress and depression check feature. I personally have tried to do this check. So when we go to this check, we will be given some questions to answer in scale. And when we already answer this, the platforms will count and will conclude whether we have high, medium, or low level of stress and depression. And if you're wondering what my result is, thank God that my result is good. I have a low level of stress and depression. And furthermore, telemedicine platforms also provide BMI calculator. This BMI calculator helps us to know whether we have uh, underweight, overweight, normal weight, or even we can check whether we have a high risk of diabetes or not. And there are so many more features that I cannot explain here right now because it will take a lot of time. But I would like to say that these telemedicine platforms is very useful for us. It has so many benefits that we can get from these telemedicine platforms. Surya and Kuryani 2022 stated on their article that telemedicine has been one of the main health service solution in Indonesia for the sick, which have a lower cost, and this can be accessed everywhere freely. Atsani and Anjari 2023 stated on their article that telemedicine psychotherapy for patients with mental health issue has been successfully carried out with the same result as face-to-face therapy. So those are proof that Indonesia has been able to bridge between health and technology through telemedicine platforms. So, as a healthcare student, I would like to invite all the healthcare workers and all the healthcare students to write as many articles as you can, and also we can do some kind of research to improve the health of the community or individual. Also, we can be a consultant or therapist for people who need. But if we are not available to do that, we can simply help all the people to use these telemedicine platforms that already built by Indonesia. And hopefully, these Indonesia telemedicine platforms can be useful and can improve from day to day, and finally can help also to improve individual and community health. And that's all from me. I hope that this speech gonna be useful for us, and see you.